Hi guys, welcome to D Squared Classroom. Today we're going to talk about one of my favorite topics, which is heart sounds. And one of the reasons I love it is that it's the only organ that you can listen to just with your ears and have some understanding of what's going on inside the body. And I'm sure that everybody who's listening has at some point put their ear up against somebody's chest to hear the thump thump of their heart. So today we're going to explain exactly what it is that you're hearing and how that can sort of indicate what's going on with a patient's heart. We'll start with a basic diagram of the heart, which as a reminder has four chambers: the left atrium, the left ventricle, the right atrium, and the right ventricle. Now, if a doctor took a stethoscope and put it on your chest, what they would hear is a very distinct thump thump. And those two thumps are identified as S1 and S2, and they repeat over and over and over again. Let's actually listen to it with something better than my thump thump. So what exactly are we hearing with those sounds? As a quick review, there are several valves in the heart that allow blood to flow in one direction, and the two valves between the atria and the ventricles are the mitral valve on the left side and the tricuspid valve on the right side. So they open during diastole, blood flows in, and then they shut closed. And that's what makes that S1 sound, almost as if a door is being slammed shut. Now the second sound, S2, is also the sound made by the closing of valves. And in this case, it's the valves between the ventricles and the vessels that carry blood out of the body, those being the aortic valve and the pulmonary valve. So again, blood flows in, the valves shut like a door is being slammed shut. So S1 and S2 are the sounds that you're going to hear in a normal heart, but there are some scenarios where you would hear additional sounds. As an example, S3 is a sound that may occur immediately after S2, and that's the sound of when the mitral valve opens and the blood hits the left ventricular wall, but it's sort of puffed out. So it's called a compliant left ventricle, meaning it's not as strong as it used to be. And that's referred to as ventricular gallop and may occur in heart failure patients. Another example is S4, which is less commonly heard and is actually immediately before S1. S4 is also the sound of blood hitting the left ventricular wall, but this time it's actually that the wall is non-compliant, meaning that it's stiff. And this is referred to as atrial gallop, and you may hear that in patients that have hypertrophy or a stiff heart. So there you have it. Now, your homework assignment is to actually put your ear up to a loved one's chest and see if you can hear the S1 and S2, which now you understand is the closing of heart valves. I'll leave you with that sound once again.